Hello and welcome. I'm Dr. Houman Solomon, and today I'm going to discuss weight loss surgery and our weight loss surgery program. I'm the Director of Bariatric Surgery at Providence Low Company Mary Medical Center and the immediate past Chief of Department of Surgery at Torrance Memorial Medical Center. We operate under guidance of a concept called Center of Excellence for Weight Loss Surgery. Myself and my partners run these programs. We have two, one at each hospital. And these are designed to provide the highest quality of weight loss surgery for patients. Everyone that you will come in contact with at our office or at the surgery centers or at the hospitals will have had training by us to take care of the morbidly obese population and those who choose to undergo weight loss surgery. We do a great job verifying your insurance coverage for these procedures. Our staff are trained in this. And also, we train you very well for the lifestyle that's coming ahead. But by far, the most important concept for everyone to appreciate is how important the role of the individual is in their long-term success, this last bullet point. A lot of people have surgeries, they don't succeed. The ones who do are the ones who understand the lifestyle needed to succeed long term. They understand they need to follow a particular diet, exercise, etc., etc. We see on weekly basis people who've had surgery and have not succeeded, have gained all of their weight back. So we instill a lot of education in you to prevent weight regain. Let's talk about the surgeries that we offer. First one we talk about is called gastric bypass. Now, before we go into the procedure, everybody needs to appreciate that each procedure induces weight loss in one of three ways. One is called restriction, second is called malabsorption, and third one is called metabolic. Let's talk about what these mean. Restriction basically means that we make your stomach smaller surgically. One way or the other, we make the stomach small. Metabolic means that the procedure improves metabolism. Now, what is metabolism? Metabolism is how fast a person burns calories doing anything. So me sitting here talking to you, I burn, this as an example, 100 calories per minute. Another person may burn 50 calories per minute. When I start up and walking, running, exercising, sleeping, all of those will have different metabolic rates. Now, metabolism suffers or ironically gets depressed as somebody gets heavier sometimes. And that's because the body needs to spend less calorie while maintaining a larger weight. That's one of the difficulties with a lot of people losing weight. They cut their calories and they don't see a lot of weight loss. And the reason for that is because their metabolism is depressed. Third way of inducing weight loss is called malabsorption, which means the body surgically is altered so that not all the calories get absorbed once somebody starts eating. Now, back to gastric bypass. First thing is, how do we create restriction? What we do is that we surgically cut a portion of the stomach, as it is up here, off the main stomach. And that becomes the new stomach, or what we call pouch. So that's where restriction comes in. It is very difficult to eat too much or a lot when you have a stomach this size. So that's where restriction comes from. Second, we alter the pathway that food takes once it hits your stomach. We make the food take a detour. So food comes into the stomach, small amount of it, and then goes on a detour as it is in this picture. How we create that is by dividing the small intestine at a predetermined distance, and we take one cut end up here connected to the new stomach, and then we connect these two portions of the small intestine here. Now, why we do this is again to create that detour so that the food goes downstream about 3-4 feet and does not have the opportunity to absorb the calories until here where the digestive enzymes meet up with food. So that's how gastric bypass works. Now, the old stomach sits here. It's kind of in a somewhat of a dormant state, does not deteriorate or go bad or anything like that. It secretes some enzymes. Eat this way. Other digestive enzymes come from liver that sits over here and pancreas that sits here. They all flow downstream as they normally would. And again, like I mentioned, food gets a detour. So that construct creates malabsorption. It is intentional. It is intended to bring about more weight loss. Third influence from gastric bypass is metabolic, like I mentioned. Now, how does that come about? Metabolic influence or benefits or improvements in gastric bypass also come as a result of this construct. It was initially unknown that this was happening, but it's fortuitous that it did because, again, it helps with weight loss. So, in short, gastric bypass has three benefits: restriction, metabolic, and malabsorptive. Now, a lot of people ask, are these procedures reversible? The answer is yes, but we very rarely reverse these procedures, namely gastric bypass, because it works really well. And if we undo the procedure, all the weight that somebody has lost will come back. Now, on average, one can expect to lose about 75% of the excess body weight after about 1 year after gastric bypass is performed. A lot of the issues that come with obesity, like diabetes, high blood pressure, cholesterol, sleep apnea, etc., they also resolve in that period of time. So all in all, really excellent procedure with very good results. We always talk about gastric bypass and other procedures and the complications that may occur as a result. In general, the way to think about complications is that no matter what procedure you have, if you have them in reputable programs, in centers of excellence like ours, the odds of complications happening are very, very low. Not zero, it's never zero, but it is very, very low. We are running nationally recognized programs with extremely low complication rates. Now, having said that, there are certain things called side effects or byproducts of these procedures. These are not necessarily complications, but sort of what happens as a result of having the procedure, usually not pleasant, obviously, but they're not necessarily they're not complications. So one side effect to talk about gastric bypass is something called dumping. Dumping is a series of things that can happen to someone after having had gastric bypass when they eat sweet stuff. So, and that happens, this phenomenon, dumping, happens in about 20% of the time, again, to people who've had gastric bypass and they decide to eat sweets. What happens is that the sugar that somebody may eat makes them really feel really sick to their stomach. They get nauseous, they get tummy pain, they may have diarrhea, they may vomit. Very unpleasant. But again, it happens 20% of the time, and if somebody decides to eat sweets. Now, some people actually choose gastric bypass because they want to have something to deter them to stay away from sweets. That's perfectly okay idea, except, like I said, happens 20% of the time. Now, another side effect is vitamin deficiency. This can happen not just with gastric bypass, but with any weight loss surgery. And it's because the individual eats so little, we restrict their food intake so little that they don't get enough vitamins. So as a result, just about everyone who has a weight loss procedure will end up needing some level of vitamin intake extra. With gastric bypass, because of the malabsorptive effect, it's a little bit more pronounced. But for example, most people end up taking one multivitamin a day, plus half the people, regardless of their procedure, will end up needing vitamin D as well. That's a thing that's a vitamin that's very low in everyone in US population. So that's gastric bypass. Next, we're going to talk about briefly about the lap band or adjustable gastric band. This is a procedure that we do not recommend as often. Nevertheless, it's covered by your insurance and FDA approved. The reason we don't recommend it is because now we know that it does not work very well in a lot of people. The results are inconsistent and not very good. But nevertheless, we'll discuss it. This is a purely restrictive procedure. Lap band is a device, something that we put inside the person. It looks like this. And it has two parts. One is a buckle that opens, and inside the buckle there is a balloon. The balloon connects via this tube into a reservoir that goes under the skin. So this buckle opens, goes around top of the stomach like you see in the picture, and then we place the tubing inside and the port under the skin. Then after surgery, we inject saline into the port, and the more saline in here, the tighter the balloon gets and faster somebody gets full with eating. That's how lap band works. Very simple, very good idea, except does not work very well. The claim to fame for this procedure is that this is reversible. Again, I talked about the idea of something being reversible. It's almost a moot point with weight loss surgery. And the fact that it's outpatient. About hour and a half after procedure is done, the person can go home. Weight loss is a lot less than gastric bypass, about 50%, and it takes twice as long to lose it. And the resolution of the comorbidities is less because the person does not lose as much weight. So the brief mention of this, if somebody is absolutely interested in procedure, we're happy to discuss it, but we don't recommend that very often. Third procedure that we do believe in and we do perform a lot of is called sleeve gastrectomy. This is a procedure where we remove about 2/3 to 3/4 of the stomach. This light pink area is cut, sealed, and removed from the person. So you can see that the new stomach is a lot smaller, bigger than gastric bypass, but a lot smaller. And the remainder of the GI tract is not really altered. So there's no malabsorption. There is restriction because there's a new stomach, and there's a small metabolic benefit as well because this part of the stomach, once it's removed, it alters the hunger hormone and that alters metabolism. So comparing this to gastric bypass, which is most people end up doing for themselves, the procedure has restriction and some metabolic benefit, but no malabsorption. So it's definitely weaker than gastric bypass. And we'll talk about that, why that matters in just a second. This procedure, since we talk about being reversible, is irreversible, okay? Once we take the stomach out, there's no way to put it back on. But you can convert it to other procedures, which actually gets done a good amount of time because people end up not losing a lot of weight, and the solution at that point is to convert this to gastric bypass. And we'll talk about that also in just a second. Again, reversing any of these procedures will result in gaining all of the weight back. Sleeve gastrectomy, I mentioned, is weaker than gastric bypass, so the amount of weight loss is less, about 60 to 65% over 1 year. And the issues that come with obesity, the comorbidity so-called, they also resolve at a pretty decent rate. Again, not as good as gastric bypass. Complications are rare, like I mentioned. And the one side effect here to talk about is heartburn. This procedure ironically increases heartburn. About 20% of people who have gastric sleeve, they end up having heartburn. So that's the one disadvantage. Now, the heartburn can be managed. We can control it, medication, etc. But that's the only side effect here to mention. Now, most people, like I said, decide to have gastric sleeve or gastric bypass. Now, why one versus the other? That is kind of a personal choice, and our job is to guide you in deciding between these two. But there's some thoughts that everybody has to keep in mind. Sleeve is definitely weaker procedure than gastric bypass. It does not bring about as much weight loss in everyone, unlike popular belief, because it's weaker. Now, that may be enough for some people, but a lot of people may not appreciate how much help they may need from the procedure. Now, who needs more help? Um, and as a result, maybe should not think about having gastric sleeve. In general, the more weight that's needed to be lost, the stronger procedure needs to be. That's one. Second, in general, women need more help with weight loss from the procedure than men do. That has to do with the fact that women usually present with lower metabolisms. That has to do with muscle mass, testosterone, etc. Having been pregnant, etc. So women in general have lower metabolisms, and as a result, may need more help. As somebody gets older, they need more help from the surgery. So all of these things come together to make someone, in our eyes, a good candidate, not so good candidate for gastric sleeve versus gastric bypass. And when I sit with each of you, we will take a very good look at your medical profile, and I'm happy to recommend one versus the other. Now, what happens is that somebody feels comfortable with the sleeve, they pick the sleeve, and what happens if sleeve is not enough, for lack of a better terminology? At that point, the person may struggle with weight loss, they may struggle getting to their goal weight, and the only option then left would be to convert to gastric bypass, which is, like I mentioned, very feasible, very possible, and safe, except it's the second surgery, and sometimes insurance companies don't pay for that surgery. So again, this is something for everybody to think about. We believe both in gastric bypass and sleeve. We think they're both very, very good operations, but we try to guide people to be very educated and knowledgeable before they make a choice. So each one of you, we can have a discussion about this and help you decide. At the end of the day, you're the boss. You decide which one you want to have, and we will support you all the way. Now, they've studied this concept of safety in centers of excellence, and it's been the same exact finding, namely, as long as you have your procedure in a reputable program in expert hands, like our program, you will be just fine with very, very low complications. We put the three procedures side by side in your handout. You can look at it at your convenience. We do a complete workup to make sure that you're safe. But most of the time you spend from, let's say, right now when you're watching this presentation till you get your surgery, is spent, studying, learning, and determined by your insurance company. Usually your insurance determines you need to be in our program 1 month, 2 months, 3 months, 6 months, and that's how long it will take. We don't hold anyone back. Once you're ready, you go off to surgery. There'll be a lot of classes about lifestyle, diet, exercise, etc. Everyone who smokes, you must quit smoking, and you cannot use any nicotine products. Nicotine and smoking cause very serious complications with these procedures. Again, reminder, we don't offer surgery to anyone who smokes or uses nicotine products. We recommend a lot of people lose weight before surgery. This is to mentally and physically get you in the game, so to say, prepare you. And a lot of insurance companies require that as well. I will tell each of you how much weight you should lose once we sit down and talk. Again, quite a bit of information about calories, the appropriate way of calorie intake. Now, what happens after surgery is most people spend one night in the hospital, home the next day, about 95% of the time. Um, by the time somebody gets home, they're up and walking, not a lot of pain, they can shower. Diet is liquid diet in the beginning and progressively goes up to solid food over the course of 3 weeks. Exercise comes at about week 3 to 4, and going back to work is a desk job. It's okay after 2 weeks, but if they let you, we usually high recommend you take as long as you can. 4 to 6 weeks would be a lot better, only to get you adjusted to the new lifestyle. Now, it is very important that everybody appreciates the fact that the surgeries are a tool. We are not giving you the magic bullet that you absolutely have to do nothing. Like I started this presentation, I mentioned that the role of the individual is extremely important. Surgery is a tool, is a very effective tool. It helps you stay on track. It's kind of like training wheels for a bicycle. The individual still has to follow the recommended diet. They still have to exercise, change the lifestyle, etc., etc. A good example of not using this tool as is intended is somebody who has weight loss surgery, but they choose to drink liquid calories. Let's say soda, um, shakes, like milkshakes, not healthy protein shakes, but unhealthy shakes. So what happens is that liquids run through you. You drink it, goes through, and it's very high calorie. Uh, let's say a frappuccino from Starbucks is an excellent example of that. So that's not using the tool the way it's intended. Or somebody chooses to use the tool in an unhealthy way again by eating foods that are very, very rich in calories, let's say sweets, cakes, fried stuff. That is not really intended uh, use of the tool. So having said that, we are not in the business of taking your most favorite type of food away from you. Okay. So if somebody has a birthday day, it's okay to have a small piece of their cake. It's okay to have an alcoholic drink every once in a while. It's okay to eat a donut, cookies, whatever, anything. It's okay, except that it cannot be every day, every night kind of a thing. Okay. So that's the intention of these surgeries. Again, long-term success is very heavily determined by the individual. The more you embrace what we teach you, the better you will do, and we'll be with you the entire journey. We're a very, very comprehensive program. We treat you as an individual. We try to our best to take your social situations into and keep it in mind to help you adapt to this new lifestyle best you can. Okay, so thank you very much for listening and watching, and we will see you very shortly in the office. Take care.